Once again, welcome back to Obstetrics and Gynecology videos. Today we are going to see the minor disorders of pregnancy and its management. During the pregnancy, all the females will experience one or another mild problems. So today we are going to see such problems. See, majority of the women experience minor disorders during the pregnancy, and if you are not considering and if you are not taking proper management, sometimes it may become dangerous. And these minor disorders are due to the hormonal changes in the accommodation, that is accommodating the large fetus and growing uterus, metabolic changes in the body, and due to the change in the posture. And almost all the systems of the body will get affected during the pregnancy. So we are going to see the system-wise minor disorders that are affecting the pregnancy. First, let us see about the digestive system. In the digestive system, the person will get majority of the ladies will get the nausea, vomiting, constipation, acidity or heartburn, excessive salivation, that is known as stylism, abdominal discomfort, and pica. This nausea and vomiting, it will occur commonly in the early morning, so we are calling it otherwise as morning sickness. And it is very common in the primigravida mothers, and sometimes it may be associated with the vomiting, or sometimes it only nauseated feeling or that vomiting sensation will be there. That is 50% of the ladies will be having vomiting and nausea, both will be there. 25% will be having only nauseated feeling, vomiting will not be there. And balance 25% will not be having any of this problem. They won't be having nausea, they won't be having vomiting, such problems will not be there. And mostly it will occur within 10 weeks of pregnancy, and it is due to the related, or we are thinking that it is due to the high levels of human chorionic gonadotrophic hormone. And the management, you can make dietary changes. You can give the food according to the likes and dislikes of the mother, and you can make behavioral changes. Sometimes, usually we will be having the pattern of taking food after brushing the teeth. But here, if they are having severe nauseated or vomiting feeling in the early morning, before brushing the teeth itself, they can have some carbohydrate or some snacks they can have. That may reduce the situation sometimes. And if it is severe, if she is vomiting excessively, she may get fluid and electrolyte imbalance. So in that case, we are supposed to hospitalize her for replacing the fluid balance. They may start IV infusion, all those things. Usually that doesn't need any treatment. A proper explanation is needed, and you have to reassure the mother if she is tensed, and symptomatic relief will be sufficient. And you can go for the home remedies. You can give ginger supplements, but all those things are not having any medical support, but you can try for such things also. And psychological support also you are supposed to give to the ladies. And you should avoid disagreeable odors, rich, spicy and greasy food. And you should allow the mother to, or you should encourage the mother to drink plenty of fluid. It will help her to replace the electrolyte imbalance and the fluid loss. And you are not supposed to take any medications without the prescription of the doctor. In case if something is needed, if you are feeling as like it is excessive, you are not able to tolerate it, in that case you can just consult a doctor, and with the prescription of the doctor you can go for the medications. Next is constipation. This is also a common problem during the pregnancy, and it's mainly due to the effect of progesterone. Already in the physiological changes, I have told you that progesterone is producing the dilatation of the smooth muscles. So here in the intestine also, in the colon also, it will dilate the muscles, and that leads to the sluggish bowel movements. That dilatation will produce the slowness of the bowel movement. That is one reason. And usually during the pregnancy, the physical activity of the lady will decrease. So that is another reason for this constipation. And sometimes the pregnant uterus, when the size of the uterus is increasing, that may apply pressure over the pelvic colon. So this also may contribute to the constipation. So the constipation may be due to the effect of progesterone, or maybe due to the compression effect of the gravid uterus, or due to the effect of progesterone, the bowel movements may decrease. That's the reason. Or sometimes when the physical activity of the mother is decreasing, proper exercises are not there, that may produce a constipation. And the management include, you should try to restore the regular bowel habit, and you should encourage the mother to take plenty of fluid and food items which are having laxative effect, and you can advise her to take a stool softener also. Food items which are having laxative effect means you can tell her to take the fruits and more fiber containing diet. Such things the lady can take. It will relieve the problem. And you are not supposed to give purgatives during the time of delivery, during the time of pregnancy, because it may induce the labor. In the earlier pregnancy, it may produce abortion because it may stimulate the uterine contraction. So you are not supposed to give the purgatives during the time of pregnancy. And you can encourage the mother to do the exercises, antenatal exercises. You can encourage the mother to do that, will help the situation, or that will relieve the constipation. And we are not supposed to take the mineral oils in order to soften the stools, because it may absorb the fat soluble vitamins from the bowel, and that may get excreted through the anus. So mainly what you can do for the management means you can just encourage the mother to take more amount of fluids, and you can encourage the mother to take laxatives. You can allow her to take more fiber containing food items and exercises. Next, acidity and heartburn. It is due to the dilatation of the esophageal sphincter, that is hiatus hernia. Sometimes hernia will not be there. See, this is also due to the effect of progesterone. Due to the effect of progesterone, dilatation of the cardiac sphincter will occur, and due to the dilatation of the cardiac sphincter, the stomach contents may get regurgitated, and that will produce the heartburn or that burning sensation. That is, the acid contents from the stomach will get regurgitated or will come into the upper parts of the gastrointestinal tract. So that is the reason for this heartburn and acidity, and it is due to the effect of the progesterone. And in late pregnancy, it may be due to the pressure of the gravid uterus. So this gravid uterus or the pregnant uterus may displace the stomach and duodenum by the uterine fundus. So that displacement also may lead to the backflow of the stomach contents. And it will aggravate when the mother is leaning forward, or when she is lying down, or when she is bending over. In those conditions, this regurgitation or this acid contents will flow very easily. So that will get worsened. Now let us move on to the management of acidity or heartburn. We should avoid overeating. We should encourage the mother to avoid overeating. Instead of eating at a time, you can advise her to have small frequent feeds, and you can give antacids to the woman. And when she is taking rest, especially during the sleeping time, you can allow her to be in the semi-reclining position with the high pillows. And if hernia, that is if hiatus hernia, in case if it is there, immediately after the delivery it will reduce or it will disappear. So the treatment is only symptomatic. We are not recommending surgery. We are not doing any other treatment. We will just manage the symptoms. And when you are changing the posture, you can tell her to be careful, and you can give hot tea. And calcium containing antacids, histamines, H2 receptor antagonist can be given to the woman. That will reduce the gastric irritation, and mainly you can encourage her to take small frequent feeds. So that's all about the management of heartburn. But remember one thing, it is due to the dilatation of the cardiac sphincter due to the effect of progesterone, and we are not going for the management or surgery. We'll just manage the lady for the symptoms. That is, you can give small frequent feeds. For reducing the acidity, you can give antacids, H2 receptor antagonist. Such things will manage the problem. Next condition is dialysm, that is excessive salivation. During the pregnancy, increased secretion of saliva is seen in majority of the ladies, but the exact reason for this salivation is unknown, and usually it is a self-limiting condition. Sometimes it may be due to the over intake of carbohydrates. In that case, you can just tell her to decrease the carbohydrate intake. She can go for the other protein and fat-rich food, and actually it is not having any adverse effect on the pregnancy. Only we can reassure the mother. Automatically it will subside after the delivery. Next is abdominal discomfort. Abdominal discomfort is due to the pressure because of the uterus, and due to the heaviness of the heavy feeling in the pelvis, and it it's caused by the weight of the uterus on the pelvic support ligaments and on the muscles of the abdominal wall. The round ligament will get stretched and pressure will be applied over the round ligament during the late pregnancy, and it is due to the traction of the uterus. That is, when the uterus is getting enlarged, it will apply pressure over the muscles of the abdomen and it will produce stretching of the abdominal muscles and back muscles, and this is the reason for this discomfort. And sometimes she may get the flatulence, and excessive distension of the abdomen may come due to the flatulence, and gas forming food if she is taking, or if she is taking heavy food, or if she is taking chilled beverages. These things may aggravate the situation. And the management, you can tell her to, or you can encourage her to take rest. So when she is taking rest, the pressure on this muscles will get relieved. And when she is taking rest, you can tell her to take rest in the lateral recumbent position. And if she is having pain or other problem, you can go for the local heat applications. And you can make her to do the dietary modifications. That is, instead of taking a heavy meal, she can take small frequent feeds, and encourage her to have regular frequent bowel movements, and encourage her to do the antenatal exercises, because these exercises will strengthen the abdominal muscles, and if the muscles are having proper and adequate strength, this problem we can reduce to a certain extent. And if she is having severe discomfort and pain, you can give Acetaminophen 3 times daily, and sometimes this may reduce the situation. And intra-abdominal disorders, if it is severe and if it is continuing, you can tell her to take the proper treatment and she should go for the further investigations. Next is pica. Actually, this is craving for unnatural substances. Sometimes it may be coal or chalk paste, whatever it is. And actually, the exact cause for this craving is unknown, and we are believing that it is due to the hormonal changes and due to the changes in the metabolism. And only one thing we can do, there is no treatment. You can just advise her this habit may affect the child and it will affect her own body negatively. So that understanding may reduce the situation. That is giving psychological support and giving proper education. That's the management. Next, we can go to the musculoskeletal system disorders. In that, the lady will get fatigue, back pain, leg cramps, and round ligament pain. The pregnant ladies will get fatigue, especially in the last trimester of pregnancy, and it is due to the change in the posture, and it is due to the increased metabolic rate, and it is due to the weight. That weight she is carrying actually. So these are the reasons for this fatigue. And the management, actually we should give proper rest to the lady. That's the main management. Frequent rest to be given. Night time we should allow mothers to sleep for 8 hours, and during the daytime minimum 2 hours rest should be there, and she should avoid hard works, and if she is anemic, that should be corrected. Next is backache. This is a common problem during the pregnancy, and 50% of the ladies will get the back pain during pregnancy, and it is mainly due to the stretching of the ligaments and muscles, abdominal muscles and back muscles. And physiological changes also will contribute to this back pain. That is, joint ligament laxity, effect of relaxin and progesterone will relax the muscles, and that muscle relaxation is a problem. Weight gain is a problem, because these muscles and ligaments will be holding this weight. It is holding around 10 to 12 kilogram of weight throughout the day. So that is a problem. And lordosis, that is, we already in the physiological changes, I told you that postural change will occur. That is, here you can see the lordosis has increased. So this postural change is also a problem, and the anterior tilt of the pelvis is also a problem is also a reason for the back pain. And in case if she is using high heel shoes, that also will produce the back pain. And sometimes the back pain may be due to the muscular spasm, or maybe due to the urinary tract infection and constipation. The management, excessive weight gain during pregnancy should be avoided. And when she is taking rest, you can just advise her to elevate the legs and flex the hips. Sometimes it may relieve pressure over the abdominal and back muscles. And usually you should advise the mother to maintain the proper posture, and in case if she is having excessive lumbar lordosis, it can be corrected by the pelvic griddle belt. And improve the posture, that is, she should not use a high heel shoes, always she can maintain proper posture, and encourage her to take in between in the daytime, in between the baths and during daytime also. And the main management is you should advise a mother to do the antenatal exercises. These antenatal exercises will strengthen the abdominal muscles and back muscles, and it will decrease the problem to a certain extent. And massaging the back muscles is also helpful, and application of heat, local heat application also will relax the tense back muscles. And otherwise you can go to a physiotherapist for the exercises. They will give proper exercise and it will relieve the problem. You can do it by yourself also, and if you are not able to do it, you can go to a physiotherapist. And in between the daytime, already told you that you are supposed to take rest. You should lie down. When you are lying down or when you are sleeping, you should lie down on a firm mattress. And if the pain is severe, you can give Acetaminophen 0.3 to 0.6 gram orally. You can give it. And even after that also, if it is not decreasing, you can go for the orthopedic consultation. And you should note the neurological changes. Sometimes it may be due to the intervertebral disc syndrome, or maybe due to the radiculitis. So in that cases, after doing this mild thing, that is after taking rest, after doing exercises, even after giving Acetaminophen also, if it is not decreasing, you should observe for the neurological signs and symptoms. And if it is there, immediately you should consult a orthopedician. Next is leg cramps. It is quite common during the pregnancy, and it will get worsened especially during the night time, and it is very painful. And the cause of leg cramps in pregnancy may be due to the deficiency of B1, or it may be due to the deficiency of calcium, or it may be due to the increased levels of serum phosphorus. And even ischemia of the blood vessels also may be a problem. And even the pH changes or electrolyte status, electrolyte changes also will produce the leg cramps. The management, you can give supplementary calcium and B complex, and you can go for the massaging of the leg. You can apply local heat application. Vitamin B1 30 milligram daily you are supposed to give to the mother. And when the mother is sleeping, you can advise her to elevate the foot up to 20 to 25 centimeter. And for once, if during the time of cramps, you can just do the gentle kneading. It will help for the relaxation of the muscles. Next, round ligament pain. Stretching of the round ligament during the movements in pregnancy may cause sharp pain in the groin. This pain may be unilateral or bilateral, and it is usually felt in the second trimester onwards. This is more common in the right side as a result of dextral rotation of the uterus. The pain may be awakening at night time because of the sudden rollover movements during the sleep. And the management, pain may be reduced by making the movements gradual instead of sudden. That is, during that night time, when she is changing the position, she should do it slowly instead of doing it fastly. And local heat application is also helpful for relaxing the muscles. And if the pain is severe, you can give analgesics. Next, we can go to the changes in the circulatory system. That includes varicose vein, hemorrhoids, syncope, and ankle edema. First, let us see the varicose vein. Usually, the varicose vein will get developed in the legs and in the vulva during the time of pregnancy, and sometimes the person may get the hemorrhoids also. And already if they are having it, it will get aggravated during the time of pregnancy. And usually if they are not having it, it will develop during the later months of pregnancy. And the reason is, one is actually already I told you that relaxation of the smooth muscles will occur due to the effect of progesterone. So that is one reason. When the relaxation of the veins is occurring, that will lead to the stasis of venous circulation. That is one reason. And another one, this pregnant uterus or this gravid uterus will be compressing the venous circulation, and that may lead to the obstruction of the venous return from the lower extremity. For the varicosities of the lower extremity, you can use elastic crepe bandage, and when she is taking rest, you can advise her to elevate the extremity, lower extremity. When it is getting elevated, it will encourage the venous return, or it will enhance the venous return. And you should advise the mother to avoid the excessive weight gain during the pregnancy. And even if you are massaging over the leg also, you should not massage in the opposite direction of the venous return. You should not massage downward, always massage upward in case if you are massaging. And if it is severe in the vulvar region or in the leg, you can go for the Jobst type or leotard garment. It will apply pressure over, or it will apply compression over the veins, and it may decrease the, or it may improve the situation. Anyway, we are not giving injections, or we are not going for the surgical correction of the varicose vein during the pregnancy, because after the delivery, sometimes it may subside automatically. Next problem is the hemorrhoid, and this is also due to the effect of compression of gravid uterus. And one more reason, the dilatation of the muscles leads to the muscles due to the progesterone. That is another reason. And constipation is a factor which is aggravating the situation. And these ladies, they may get the varicosities also. And due to the hemorrhoids, it is painful, and it may be irritating for the mother, and sometimes it may get prolapsed, and sometimes she may get the bleeding also. And in that case, for the management, you should give regular laxatives, and local application of hydrocortisone ointment may relieve the problem in case if it is getting projected. And usually the surgical management of the hemorrhoid we are not doing during the pregnancy, because sometimes after the delivery automatically it will get improved. And always you should avoid the constipation, because if constipation is there, means again it will worsen the situation, and we are not going for the suturing of the thing. You can encourage the mother to take sitz bath. You can give rectal ointments. You can give suppositories and mild laxatives to avoid the constipation. And other injections or treatment and other things are not recommended during the time of pregnancy. Only the time being management we are doing. Mainly we are taking measures to avoid the constipation. Next condition is syncope or faintness. Sometimes when the pregnant ladies, when they are changing the position suddenly, that is from the sitting or lying down position when they are standing suddenly, or sometimes when they are maintaining the standing position for a long period, they may get the fainting. Even without, sometimes during the sudden change of position, or sometimes even if they are not changing the position also, if they are maintaining a standing position for a long period, they may get this problem. And it is mainly due to the stasis of venous return in the lower part of the uterus, lower part of the body. So what will happen means the blood supply to the heart will decrease. So when the blood supply to the heart is decreasing, naturally cardiac output also will decrease. And when the cardiac output is decreasing, blood supply to the brain also will decrease, and that is one reason. And another reason may be due to the dehydration, or due to the hypoglycemia, or maybe due to the overexertion. Because of these problems, the lady will get the faintness and syncope. And it usually resolves if she is taking rest in the lateral position, and if she is avoiding the sudden change in the position. And it is usually common in the supine position, and if she is taking rest in the lateral position, the blood supply from the inferior vena cava can be increased, and by that way we can reduce the problem. And if she is having the recurrent attack, she should go for the cardiac evaluation, cardiological consultation. And even if she is taking heavy meals, sometimes it may compress the inferior vena cava, and you should allow the mother to take small frequent meals instead of the heavy meals. And if she is having mild problem, you can give her the stimulants like coffee, tea, or spirits of ammonia. So sometimes that may stimulate, and it may relieve the postural hypotension. Next is ankle edema. It is evidenced by marked gain in weight or evidences of preeclampsia. Preeclampsia means, already I told you, it is sudden increase in blood pressure during pregnancy, and it is associated with edema and proteinuria. So if edema is there, means you should suspect either it may be due to the sudden weight gain, or it may be due to the preeclampsia. So immediately you should check the blood pressure. And usually it will develop in 2/3 of the women in the later pregnancy, And sometimes it may not be due to the preeclampsia or other due to weight gain. Sometimes it may be due to the water retention in the lower part of the body, especially in the legs. That is already I told you that venous return will be less, and it is due to the pressure of the gravity uterus, and it is due to the effect of progesterone. Sluggishness of venous return will be there, so pooling of venous stasis will be there in the lower extremity, and from this stasised venous blood, exudates or extravasation of the fluid will occur, and that is also a reason for the edema in the lower extremity. And if the mother is having generalized edema, if it is there all over the body, sometimes it may be physiological, but if it is all over the body, you should take it seriously and you should go for the investigation. Usually the edema in the lower extremity that doesn't need any treatment, if the mother is taking proper rest, automatically it will subside, and when she is taking rest, you can advise her to elevate the lower extremity 20 to 25 centimeter, and you can encourage the mother to use the elastic stockings. It will decrease even the edema, and it will decrease the varicose vein also. And usually we are not giving diuretics during the time of pregnancy because the diuretics may become harmful for the mother and for the fetus. Next, problems in the nervous system. It includes insomnia, headache, and carpal tunnel syndrome. Insomnia is lack of sleep, and it is common especially in the later pregnancy, and it is due to the increased fetal movements and maybe due to the frequency of maturation, and sometimes she may get difficulty to find a comfortable position, because if she is taking rest in the supine position, it will press the inferior vena cava. This gravid uterus will compress the inferior vena cava, and she will get the decreased cardiac output, and because of the decreased cardiac output, the baby also may get decreased amount of oxygen. So she is supposed to maintain the lateral position, and in the lateral position also we are recommending left lateral position. Throughout the night, if she is maintaining only a single position, it will be difficult for the mother. So that is a reason for the insomnia. And another one, especially during the late trimester, she will get the frequency of urination. So that is also a problem. Another one, when the mother is taking rest, the fetus will become active and the baby will start to move. These fetal movements also the mother can perceive, and that also may cause the insomnia or lack of sleep. And sometimes the lack of sleep may be due to her tension or maybe due to the anxiety. And the management, you can encourage the mother to take rest in the afternoon, and before bedtime you can encourage her to take a glass of warm milk. And in the left lateral position, when she is lying down, you can just tuck pillows under the abdomen. This will encourage comfort, or this will give maximum comfort for the woman. And if she is having fear and anxiety, you can give psychological support, and you can explain her about the process of labor, onset of labor, all those things. Next is headache. Usually during the pregnancy, it's common, and it may be due to the tension. And refractive errors and other problems are not usual in the pregnancy. And if the headache is severe and if it is persisting in the third trimester, immediately, sometimes it may be due to the eclampsia, you should check the blood pressure. Otherwise, if it is not associated with the eclampsia, that is, if it is not due to the high blood pressure, immediately you should go for the consultation. Next problem is carpal tunnel syndrome. That is, it's a pain and numbness in the thumb, index and middle finger, and it is mainly due to the compression of the median nerve, and this compression will be due to the retention of fluid, or that is due to the edema. See here, you can see the anatomy of carpal tunnel syndrome. The median nerve will get compressed over here if the lady is having edema in the wrist joint. So this will compress the median nerve, and because of that compression, all these nerves, the nerves which are supplying to the fingers will get compressed, and that is the reason for this numbness and the pain. See, the management of carpal tunnel syndrome is also symptomatic. We are not going for the surgery or for the steroid injection during the time of pregnancy, because after the delivery, automatically it will get resolved. And for the symptomatic management, You can encourage the mother to do the exercises, and you can apply splint during the night. So because of the splint, slight flexion of the wrist will be there, that may relieve the problem. Next, we can see the genitourinary system. In that, it includes the vaginal discharges, leukorrhea, and urinary symptoms. During the pregnancy, excessive vaginal discharges are common. So you just advise the patient about it, and you can encourage her to maintain the cleanliness. But in case if she is having the signs of infection, that is if she is having foul smell, or if it is associated with irritation or itching, in that case you should suspect the fungal infection or candid infections, or you can suspect the bacterial vaginosis also. And if you are suspecting an infection, you should go for the local application of metronidazole or miconazole. And next is leukorrhea. That is gradual increase in the amount of non-irritating vaginal discharge will be there during the pregnancy, and it is due to the estrogen stimulation of the cervical mucus, and it is normal during the pregnancy. And usually it will be milky, thin, and non-irritating, and it's not having any foul smell also. And only the problem due to the persistent moisture, sometimes the lady may get mild pruritus, and if it is associated with itching, or if it is severe, or if the nature of the secretion is getting changed, that is instead of milky thin, if it is looking as like curdy, it may be due to the infection. And the management, in this case also, you can tell the patient to maintain the hygiene, and they can, if it is excessive, if it is wetting, she can use the protective perineal pads. And if it is associated with pruritus or discoloration or foul smell or associated with the bleeding, she is supposed to take the treatment. Next, urinary symptoms. Sometimes the lady will get the frequency of urination, sometimes she will get the urgency of urination, and sometimes they may get the incontinence, that is involuntary passage of urination. Sometimes they may get the stress incontinence, that is when they are coughing or when they are sneezing, or involuntarily they may pass the urine. And it is quite common in the multigravida mothers, or in the case of multipara mothers. And it is due to the increased intra-abdominal pressure and due to the decreased bladder capacity. That is when the uterus is applying pressure over the bladder, the capacity of the bladder will decrease. And if the person is having painful urination, that is dysuria is there, or if the person is having hematuria, that is if blood is passing through the urine, it should be conscious, it may be due to the infection. In that case, they should consult the doctor. Otherwise, this frequency, urgency, all those things are common for the pregnancy. Only the thing you can reassure the patient. If the mother is having frequency or urgency of urination, if it is problematic, you can advise the mother to reduce the caffeine, spices, and the beverages. That may reduce the problem. And if she is having the chance of getting infection, or if she is suspecting urinary infection, you can encourage her to take more fluid, and you can encourage her to take lime juices or cranberry juices. It will increase the urinary acidity so that you can prevent the urinary tract infection. The ladies will get the breathlessness during the time of pregnancy, and it is not dyspnea, it is due to the effect of progesterone. And sometimes they may get in the later trimester, they will get the breathlessness. It is due to the effect of progesterone. And one more reason is that this gravid uterus, when the size of the uterus is increasing, it will displace the diaphragm upward, and the space inside the chest cavity will increase. That is also a reason for this breathlessness. But if sometimes the people, those who are allergic and others, they may get this breathlessness from 12th week of pregnancy onwards. Others will be getting it from 30th week of pregnancy onwards. And there is no management for this. Only the thing, you can encourage the mother to take rest in an upright position. And another one, when she is taking food, you can advise her to take small frequent feeds. Next is problems in the skin or integumentary system. And some ladies will get generalized itching, especially over the abdomen, and it is due to the higher response of hormones, especially from the liver, and it may be due to the raised bilirubin level during the pregnancy. And the management, only the thing, you can advice, you can assure the mother that it will get relieved once if after the delivery, and if it is severe, you can give antihistamines. And if she is having the complaint of vulvar irritation, or if she is having thrush or glycosuria, it should be, you should see whether the patient is diabetic or not, and it should be treated. Otherwise, washing the area with mild soap and using cotton underwear, all those things will decrease the irritation, and you can apply emollients over the abdomen. And the disorders that require immediate action, that is, if the following features if you have seen, immediately you are supposed to take the treatment. That is, if the mother is having vaginal bleeding, if the fetal movements are decreasing, if she is getting frontal headache or recurrent headache, if she is getting sudden swelling and edema, if the membranes are rupturing, if she is getting premature uterine contractions, sudden onset of nausea and vomiting, and if she is having epigastric pain, in these cases, immediately you should take her to the doctor. So today we have seen the minor disorders of pregnancy in the digestion. So we have seen what are the minor disorders that will occur in the digestive system, musculoskeletal system, circulatory system, nervous system, genitourinary system, respiratory system, and integumentary system. So thank you for watching this video. See you once again with a new video. Bye till that.